Today. I am here to present our initiative. I didn't know if somebody else just joined, but I'll go ahead and keep going. I'm here to present on our initiative, which is called Target Blood Pressure, and we are doing this in conjunction with the American Medical Association. It is a program that we have launched 2 years ago to help better control hypertension within communities in a clinical setting. So first, I'd like to just start out by kind of giving a really shocking statistic and fact, which is in 1 year, over 15,000 people in Tennessee died of heart disease, and that's enough to fill the Ryman Auditorium 6.5 times. And so just wanted to level set with why we're here, and that hypertension is one of the leading risk factors contributing to heart disease within the state of Tennessee. And we currently have over 30% of our adult population with uncontrolled hypertension at any point. So Target BP is a real-world program to help you better be able to control blood pressure within your patient population. We are working to do this at both a national and local level, and we've done this obviously in conjunction with the AMA. And we have a goal within the program, which is to help you and your clinical population reach a 70% or higher control rate. And we have a multitude of ways we do that. And so here's a little bit more about where we currently are. And we have 600,000 patients that are enrolled in Target BP or covered by the program throughout the state. And we've been doing this since 2015. And it launched here in Tennessee in approximately the end of 2016, beginning of 2017. Here is a little bit of an example of the types of clinics that have currently signed up throughout the state and nation. And one thing I'm excited about with working with the Tennessee Charitable Care Network is being able to bring dental practices into this fold. We do not currently have a lot of dental practices signed up. We do have some other charity care practices that have both a dental component and medical component that have signed up. But one of the reasons that I think this might be an exciting endeavor for some of the dental clinics within the Tennessee Charitable Care Network is that within your patient population, you're sometimes serving in multiple levels. So you might be working as more of a primary care leading physician, whereas in some of the other clinics that have signed up, that's not necessarily the case. And I'm happy to help explain in further detail how we can adapt the existing program to meet more of the dental needs. But just wanted to give that high-level overview of how adaptable the program has been through all these other clinical settings across the nation. So what is the program? Target BP itself consists of 2 parts. One is our BP improvement program, and that works with, that deals with a direct partnership between both the American Heart Association and American Medical Association and your clinic. We provide resources, both physical resources and then online resources, and we have regular training updates through and that provide CEUs. And the second level, which we are really working on as well and feel is in strong conjunction with the first part, is a recognition section. So we'll ask for annual data entry, and then we also provide award recognition based on your clinic's control rate. I'm going to give an overview of how the 2 parts work together and kind of broad picture of what they look like. So within the BP improvement program, we utilize what's called the MAP framework to help a clinic better control patients' hypertension. So the MAP framework consists of M for measuring accurately, A for acting rapidly, and P for partnering with patients. And as you can see in the Venn diagram in the upper right-hand corner, we really feel that all 3 need to be done in conjunction in order to help control a patient's blood pressure. So we kind of break these 3 down though, because it's a lot to do for a clinic to take on doing the MAP framework in totality. And so we start generally with focusing on the M for measuring accurately. And so we do this by providing some participant resources for your own clinic setting. And we can also come in person and help address some of the issues. So the very most basic place that we start is ensuring that you are actually measuring the patient's blood pressure accurately by following best practice guidelines. So that can be everything from making sure a patient is seated, has their feet flat on the ground, that the device you're using is accurate, and that you're getting an accurate reading. And so that we feel that really focusing in on M is crucial to then acting rapidly, because clinicians have to have a blood pressure reading that they trust and that they believe in order to then feel confident about acting and treating a patient as quickly as possible. So M is probably the strongest section within our website, which is targetbp.org. And if you go there, you'll see that we have a lot of different things, including ongoing trainings that you can look at any point. And so they're kind of webinars that we host, and we do those both live, and then also we put them in a training calendar so you're able to look at them. And the videos are always available for you. Then I have personally, or the American Medical Association has sent out representatives to look at your clinical setting to see if there's little things we can do, like just rearranging the placement of a chair in a room, or looking to see if there's an area that we could put up information about how a patient should be measuring their blood pressure should be measured, etc. And so we really can customize and adapt to your clinical surroundings. So here's just a little bit more information on the internal considerations that we have on identifying hypertension, which is really around changing the conversation. So we look at it through a team-based approach from everyone from intake to MAs. So that could be changing the way that you're notifying patients about an appointment and making sure that you have expressed to them that fasting does not mean to come in without taking your blood pressure medication. So in some of the recorded phone calls that some practices use, we have done, even the receptionist takes part in Target BP programming, because when they're talking to the patient or connecting with them, they're sure to relay that information. Also ensuring that the patient isn't drinking coffee or has enough time right before their appointment so that they're not having caffeine, or that they've had enough time to settle down and they haven't just used a nicotine product. But so we work within the complete clinical setting to do this, and it is not that we see the physician as being the person that can solely do the treatment of blood pressure. It really is a complete clinic setting that needs to be working towards this. We offer, and these are both available online, as well as I can provide hard copies if you need them, but we offer many practice assessment tools on how to take an accurate blood pressure. And we can adjust these based on the equipment that you have. So do you have a mounted blood pressure device? Are you using semi-automated or fully automated? We ask you to ensure that they're being calibrated timely. And then each of these can be customized based on the equipment that you have in your facility. And so these are again offered for you at any time. Then we also do technique check guides that we find very useful for whoever is the person that's capturing the blood pressure reading. So this could be, in some practices it's the MAs, and some it's the actual physician or the NPs. So we have little quick check guides, because there's often high turnover that we've experienced, especially within the MA population in different clinics. And so this is something that we can keep and that you can build into your workflow or onboarding process. And again, these are just some more examples about different materials and assessments and guides that we have. We're happy to advise on blood pressure self-monitoring loaner programs, inventory management programs, different ways to just ensure that you can have the tools that you need, but also to ensure that patients are able to have, if you have available resources for patients, that you're able to keep inventory of your equipment as much as possible. We have videos that are available for both train the trainer types, and these again can be found on the Target BP website, but we have videos for train the trainers. And then we also have video links that you can share with patients as well. Then other resources that are available is, again, virtual and in-person support. We can work with your staff to do full facilitation trainings to help them be able to measure accurately, or do group trainings that we have offered throughout different regions. We offer monthly webinars that are always available, and many of them have CME, CEU, CE credits attached to them. And again, those are, you're able to pull those up at your convenience because we keep a running list of them. We have collaborative learning, which is that we have monthly office hours, and you can get live questions answered by Target BP experts. And so you can have the chief medical officer of the American Medical Association answering direct questions about different treatment algorithm issues you may have, or pharmacological things, best practice. And so there's a lot of care coordinators that join the calls as well. And you can hear from your counterparts across the nation on what's working well, what's not working, and kind of get best practice advice. And then that's also an opportunity to either do it then, or you could share with me resources that you don't see available on the website that you would like to see. And Target BP is a living, breathing website where we are constantly adding new information, and we are updating with the latest guidelines and resources. And what we're really excited about is we're often able to share things that we've noticed have helped with other patients across the nation. So, for example, we have just recently added a bookmark, which we think that has on it a detachable blood pressure self-monitoring wallet card to it that was developed in coordination with some of our work with libraries. And it's something that's easy and accessible for patients, but also helps keep mind about blood pressure monitoring. So that's Target BP, the website itself, is something that you could spend a lot of time on gathering resources. We have tons of materials available for your patients. We have them in multiple languages. So if you have a Spanish-speaking population, we have patient resources for them as well that you could print out yourself from the website. Or once you register for Target BP, if there are other things that you feel you would like to see or that you need because printing is a financial barrier to your clinic, then I am happy to print them out and give you those materials yourself. So that's the first part of Target BP. The next component of Target BP is the data entry and recognition program. And again, we really see these two as going hand in hand and being essential, because once you start implementing the MAP framework and the BP improvement process for your patients, we would like you to be able to see those differences in the population you're measuring. And so that's why the data entry is really an important component to this. So data submission will be one annual data submission, and this year it opens in February and the data submission portal will close in May. We will ask a few basic questions, and so there's only a few required fields, and one of them is your total patient population between 18 to 85 for your healthcare organization, your total patient population that has been diagnosed with hypertension, and for the level of hypertension, we use 140/90, which falls in line with the national, the NQF measure, the National Quality Forum measure still, and ensuring that that's what you're turning in as the number. So has a patient had a diagnosis? And then of all your patients that have been diagnosed with hypertension, what percent of how many patients have it under control? So have come back and had a follow-up reading where it's now under 140/90. And then some basic healthcare organization information, such as how many providers do you have? And for that, you would enter everything from physicians, nurse practitioners, dentists in the dental clinic case, physician's assistants. With that information, you would take and we would create what's a numerator denominator to get your percentage of patients that have their hypertension under control. And again, this is aggregate patient information. It's not specific, and it's done once a year, and you would be able to submit it through the Target BP website. So here are some information about the data reporting capabilities. So again, for the BP control rate measure, we use the NQF 18, and we do that at an aggregate level. We use benchmarking options. And so these are the ability, and I will go into this in a little bit more, but if you have, we're able to take the data that you provide and provide benchmarking options for you at a site level to compare to your region, your state, your facility level, practice size, etc. And then we can provide a recognition report, which is a snapshot in time of all facilities and data at the close of recognition for the BP control rate, and we'll provide our award assignment. There are 2 levels of award for the Target BP program. One is participating, and that's just that you have registered and you are submitting the data. And then we have a gold status, which is that your practice has achieved a control rate of 70% or greater for your hypertensive patients. We will ask that you also do, within your data, you submit a, using a prevalence estimator, and we use the Million Hearts Hypertension Prevalence Estimator. This is an example of the benchmarking that I was talking about, and for some facilities, this is really useful when you have multiple sites, but you can also break this down by individual physicians if you want to do benchmarking within your patient population. And so you can look, and here where we have healthcare organizations, you could also use physicians, and you can put in specific physician patient population and kind of measure and see how things are happening in controlling different patients' populations. At the bottom of this slide, you'll see the information that I was mentioning that you will need to provide for the overall data. And so there you'll see the adult, you'll enter the adult patient population, the numerator, which would be those that had their hypertension under control, the denominator, which is your total hypertensive population, which equals then to a percentage, which is the performance rates. And that would be the percent that you had under control. And then your then the 95% confidence rate is on the side, and that's tied to the prevalence estimator that we mentioned earlier using the Million Hearts. So again, to go over the data submission requirements. So at registration is probably one of the easier times to submit data, but once you've done it, it will be every year they will open again. And this year the data submission portal opens between February 2nd to May 31st. And then every participant registered before January 1st, 2019, which was a few of the clinics through the Tennessee Charitable Care Network, have already received an email notification indicating when you'll be able to submit data. Again, we have listed the recognition data that we're looking for throughout your patient population. Here you will note that the total patient population by ethnicity is an optional opportunity to enter more data on your patients. We highly encourage you to enter as much patient population data that you're able to, including by ethnicity, so that you can help better identify areas and gaps for improvement within different patient populations that you're treating. So again, to go over the validation, and this is the part that has to do with the Million Hearts Prevalence Estimator, we will look for your total number of patients that you've put in. There will be the validation tool, which will be used. The validation tool is based on the Million Hearts Prevalence Estimator, and it will calculate a range for the number of patients that you're seeing that should have hypertension. Now, I would like to put a caveat here, which is that if you are getting an error because either your patient population is too high or too low and outside of the prevalence estimator, but you are confident in your data numbers, you would contact me, and I would, on the back end, override the prevalence estimator. An example of where this has been needed is within a hypertension clinic specifically. You will have 100% of patients that are diagnosed as hypertensive, and that automatically would air out the prevalence estimator. And so I have gone through on the back end and I override that and allow the data to be entered. That doesn't happen very often because the Million Hearts Prevalence Estimator is a really nationally used, recognized tool. So it will work in most cases, but I did want you to know that if it is not, if the prevalence estimator is off for your population, then I can fix it on my end. So within the population data itself, for the prevalence estimator aspect, what we would be looking for is totals by age groups. And this is, again, something that is very important when looking at your patient population to identify gaps within your practices. So we break them into a few different groups, which is 18 to 44, 45 to 64, 65 to 74, and 75 to 85. And you would just get your aggregate number of total patients for each. Then you can use ethnicity, which we have listed as optional, although we encourage, again, everybody to use this if possible in order to have the best treatment for your patients. And then that's separated into male and female. That might have sounded a little confusing as I've been explaining it. So here is an example of really how simple it is. And we have a sheet where you can actually, it's a one-page sheet, and I'm happy to provide it to you. And it has these 4 different boxes on it. And that's all the data we're really looking for. I know it sounded probably more robust while I was explaining it, but we encourage practices to sit down and with the one-page sheet, just fill in these boxes. And then when you go to submit your data, you're literally just typing in what you already have on your sheet. And it really is just a one-page sheet for all the data that's required to be entered. And that happens, again, 1 time a year. Although there are some practices that use these same metrics and do it and update more than once a year. So if that's something you're looking for, that's also an opportunity that you can do with the data. Here is the actual screenshot of what you would see when we're using the prevalence estimator. So those boxes that you just saw on the last slide would be put into each of these boxes, the red highlighted boxes here. And so it's just an example of what that would look like. And so just keep going along as more examples of what it would look like. And so this is another validation example of what it would look like with the prevalence estimator and what they would be looking for. Again, if there is some kind of error where you're not able to, where you are confident in your numbers, but it's not allowing you to hit the submit button at the end because of the prevalence estimator, I will be able to easily fix that in a day. So now we get into the recognition component, which is something that a lot of practices find a lot of value in. And so within the recognition for target BP, there are the 2 levels: participation, which recognizes any healthcare system or facility for registering and submitting data, and then gold level achievement for those practices with a patient population having controlled blood pressure over 70%. Within the recognition component for the Target BP program, we provide social media messaging. We give you actual physical plaques, window decals. We do press releases that we release to both local and state media. For anyone that receives over a 70% achievement, so the gold status, you are published in Beckett's Review, and then also additionally promoted nationally through different media channels. So some of the things that I want to just address on the front end about the program is that this program really will only give you what you put into it. So for example, there are literally hundreds, if not thousands of resources available to each practice. And that is, can be both formidable because it can be a little bit overwhelming, but does present the opportunity to really customize the resources needed for your specific patient population. And that's why it is so expansive. Whenever you use the framework itself, it will only work as well as you are implementing it within the clinical setting. So if you're just implementing one part of the MAP framework and focusing on the measuring accurately, you may not achieve the control rates you were thinking you would hit, but you will at least achieve a more accurate blood pressure reading. And so again, it is what you put into it. And then the targets you hit are really going to be something that you're going to need to adapt and base on your own personal patient population. One thing that I would also like to point out can sometimes happen is because some of our practices have not focused on measuring accurately. So in year one, you may have what you think is your current control rate for patients, but because you really implement M in the first year, the next year when you enter your data, your control rate can sometimes go down, but that is because you will now have a more accurate representation of truly who is hypertensive. And then obtaining the numbers that you'll need for the data input. Who does that? That's actually clinic by clinic, and we have some different webinars that can help depending on the tools that you're using. We've had everyone from clinics that have paper records, they're using Excel sheets, they're using fancy EHRs like Athena or Epic, and those in between, and they've all been able to successfully enter the data. And so we've actually had a lot of, probably the most success in data entry has come from the FQHC setting, but we've had success in all, and we're happy to help in any way that we can for advice or helping you get numbers from your own data. So within this, we really recommend having one person be the lead in pulling the data, ensuring that you're able to get all of those different segments that you need for your different ranges and patient populations. And again, it really is one sheet that you will need to fill out for the Target BP data section. So registration for Target BP will require the name of your healthcare system that you're signing up, an address, a contact name, and email, and then you will be assigned a site ID and a user ID. And then after you are assigned this, an email notification and authentication will come through for you to be able to register. For anyone that wants to have the super user capability, and so you have multiple sites that you would like to register, please let me know that, and on the front end, we can work when signing you up to ensure that we're able to have you, to ensure you have the correct view, and that each individual site is able to establish their own site ID so they can see their data, but that you have one super user designated that would have the full range of all the data for the system. Here is, there again is the targetbp.org, which is the link to the Target BP program. And this is a screenshot of exactly what it would look like when you go there. You can see that sign up will be on the bottom, and then there is information on how to do the program process and steps, as well as information about the recognition program. So here are a few really important dates that I'd like you to keep in mind for this year. Data submission opens February 2nd and runs through May. If you plan on registering and submitting data, I would like to encourage you to do this as early as possible throughout the year in the data windows, the data submission window, so that way if there are issues with wanting a super user account, or there are issues with the prevalence indicator that I need to override, I'm able to do all that as early as possible. Also, I think it will be helpful for your different practices to work through this and make sure that you have the data points needed. We will have a Target BP registration webinar that will be hosted on February 12th. So for anybody that would like more information on how you register and all the points that you're going to need, that's going to be available to everyone. I'm happy to provide that link to Sarah and Mary after this webinar, and they can disseminate that to you, and you're all encouraged to join. And then our Target BP award dates this year will be September through November. So after your data is submitted, we will look at that and aggregate it, and then I will personally be contacting you about your Target BP award level and provide you with a press release and your plaque, as well as social media messaging. So that was, at a very quick and high level, our Target BP program. And now I'm happy to answer any questions that you may have.
Okay, I'm gonna go, thank you very much. I'm gonna go ahead and unmute everybody just so that you know that we will all be able to hear you if you're speaking. All right, terrific. Does anybody have any questions?
Hi, it's Rhonda, and I do. So when you're talking about the number that you have diagnosed, so as a dental clinic, we wouldn't be necessarily diagnosing it using diagnostic codes. So is it defined as, because someone could be under control and would not self-identify as having such a diagnosis, do we say when they're on medicine that gives them that diagnosis, or how do we determine that other than just the ones that we catch ourselves? You get what I'm asking? Yeah.
I think that's a great question, and I think that there's a couple different ways you can handle that. I think the key would just be ensuring that you're going to use the same metrics for the patient population you're going to enter each year. So if you want to do somebody that, and you're able to pull up through your system, anyone that's indicated they're on hypertensive meds and make that the indicator, I think that's an option. If it's going to be anyone that's self-diagnosis and you're able to capture that information, you could use that. I really think the key would be just ensuring it's consistency year on year, that you're ensuring you have the correct patient population identified. And I'm happy to kind of, without knowing your specific capabilities and how you're entering each patient, I'm happy to try to help give best practice recommendations for your specific setting.
Yeah, and it's all because the dental software, it's not one of those, it's only if it's found as a medical alert.
Okay.
And I'm not even sure, and this has been the holdup, of getting the dental clinics involved, because how do they track such a thing? It's obvious in the medical software, but in the dental software, so it's trying to set it up as a medical alert and then being able to sort by medical alert. Otherwise, you have to tag each customer specific to that. So, and then put in again when you establish that they're controlled and know that that changed. So I think it's going to be very individual, but if we can figure it out together, maybe you and I, and we set some kind of standard, then we can tell the other dental clinics, hey, this is how you can adapt your dental software to make this work. Because we do want to be, if we can't track it, it doesn't help.
Yeah, I think that's a great point, and I'm happy to, after this call, set aside some specific time to better understand kind of how the medical alert would work within the dental software and see what we could look at as having kind of a best practice for dental clinics within TCCN.
Okay, awesome. Thank you.
Yeah.
Anybody else?
Yeah, Denise, hey, this is Kelly from Caris Dental. I'm just wondering, when we register and go to that process and programs, will it show us the data, the specific data you're looking for, like the actual sheet that we'll be entering so that we know exactly how to gather data?
Yes, and I can additionally provide a follow-up, which is just the simple one-pager of the sheet that I was mentioning with those boxes from the example. Yeah, I'll be sure to give that to Sarah and Mary so they can send that out too. But it would be
perfect
within the Target BP website, and you would see it when registering, but because it may be a little bit hard to navigate the website at first until you become familiar, I'll send that out separately.
Okay, great.
Mary, and I don't have a question. I just wanted to mention that Denise is folks that are available across the state. So when they say they can come to your clinic, they really can have regional visits.
So I think, what Mary's saying, is that correct, Denise, that you've got multiple representatives across the state that can pay a literal visit to the clinic?
We do have multiple, although again, because we're covering such a large patient population, we do have kind of some resource issues that may happen, but we can physically, because we do physically cover the entire state of Tennessee with somebody that represents every market and every county, we can be there. It just would be a matter of time and arranging to ensure that we can cover and come for an appropriate amount of time for a site visit, but we're happy to. And then I'm also happy to share that my counterpart, who is our Vice President of Small and Rural Markets, will be at your conference in March, and she covers any of the areas that me or my representative from Memphis do not cover. And you'll get to meet her in person for everybody that's there.
Great, thanks.
Yeah. Any other questions? Okay, so Denise, I'd like to thank you so very much for your time. This has been wonderful. I'm going to go ahead and make sure that everybody gets a link to this particular presentation if you want to play it back. And I'll also make sure that you get Denise's direct contact information. And if there's anybody else that has any questions, as soon as you hang up, if you realize you had something that you